Hi, I'm Dr. Robert Walls, Back for Life Chiropractic. I wanted to talk to you about sciatica and stenosis. Stenosis simply means that the spine is encroaching down upon the spinal nerves, and when that happens, that can cause pain or dysfunction wherever those nerves go to. Stenosis can come from a compressed vertebra where it's pushing down upon the spinal disc, and the disc is pushing upon the nerve. Now, there are different kinds of stenosis. There can be central stenosis, which occurs at the back of the spinal cord, and up here in this part of the spine, that stenosis from the central part can actually compress the spinal cord. As we get down into the low back and the spinal cord ends in this area of the spine, then central stenosis is not that much of a factor because the nerves in this part of the spinal canal are actually free floating. So the other type of stenosis is bony stenosis. That usually occurs in what is called the lateral recesses, and what happens is we get hypertrophy or an enlargement of the bony parts of the vertebra, and they can start crowding down, pushing upon these spinal nerves. When this happens, you can have pain all the way down to your fingertips. Pain or numbness or tingling can be any of those symptoms. When we have compression down the low back, which is a huge problem, when it becomes severe enough, it can actually affect what's happening in this big sciatic nerve. Maybe you can see that right there. When these nerves are irritated, one or more, then the sciatic nerve can carry pain, numbness, tingling sensation all the way down to your toes. So what do we do about sciatica and stenosis? The procedure is called spinal decompression therapy. In spinal decompression therapy, the goal is to separate these spinal bones. And when we separate them, it's going to do several things. Number one, it's going to allow the disc to imbibe oxygen and water, and you're actually going to be taller after your first treatment. And with this comes healing. We're breaking up adhesions on these nerves and giving these nerves a chance to breathe, so to speak. So it's real important that you open things up so that things can heal. One of the things that we've added to our decompression facility is called brain-based therapy. In brain-based therapy, the purpose is fuel and activation for the nervous system. And it's something that, frankly, we in chiropractic have been missing it for many years. We've been doing a lot of activation of the nervous system with our chiropractic adjustments, but we have not added fuel in the form of oxygen so that the nerves and the brain can heal. People that have chronic pain are going to have dysfunction in the circuits of their brain that are not going to let them heal fully. And the cerebellum, which is the bump on the back of your brain that is responsible for coordination, is the biggest user of oxygen in the whole body. And people that have chronic pain, they're going to have a cerebellum that's just not working good. So with the activation and fuel that we do with the brain-based therapy, you'll get a much better end result than you'd ever believe. I hope you'll come check us out. Thank you.